add a few points, and then I'll focus on one specific area like I did yesterday. Just to add to his update on the cases, in addition to the cases, some of these are individual cases that have come back, have been infected, but some of these are also parts of larger clusters. So we are investigating them. There's a ship cluster, a number of people that were on a vessel just outside of Lagos, and a number of people that were investigated and became infected as part of a group of people that came back to Nigeria together. So this is very diligent work. Every case is investigated, and sometimes through that investigation, we find out that there are a cluster of cases, we investigate them, and then the public health measures are focused on that specific scenario. But for most other cases, they're individual cases or within their families, and those are managed appropriately. So this very hard work will not be possible without some technology. So I'll focus the last few minutes on briefing you on some of the work that we're doing across various aspects using technology that you have access to some extent. So for all our surveillance and contact tracing, we're using a digital platform called SORMAS to collect information on all the cases, all the contacts. These are then displayed on dashboards at the federal level, at the state level. With those dashboards, we understand the progress of case finding every day. That dashboard informs us on where the contacts are, where the cases, which contacts are linked to what case. So it is with this information that we send out teams every morning to do the detailed investigation required. As at this morning, we are following up on 70% of the over 5,000 contacts that we have identified. Every day, we are pushing that number higher, and that is one of the key purposes of the lockdown in Lagos and Abuja and the Ogun State, to enable the teams find these contacts, make sure that those that are sick, bring them into care. Those that are well, follow them up for 14 days. So this is the primary strategy at the moment. We couldn't do any of this without the technology to support the work that we're doing. So in addition to the dashboard, everybody has a handheld device that they use once they go to the individual's home or call them, they put in that information. Immediately that information is put into the handheld. It appears on the dashboard. We know whether that person has been seen on that day or not seen on that day. We monitor that in real time in our emergency operations center. The other bit I'd like to share with you, and I hope you visit because we've spent a lot of effort making this as user-friendly as possible, is the website www.covid19.ncdc.gov.ng. We know there were some problems about a week ago. This was just because of the traffic to the site. Working with some of our partners, we have now enhanced the accessibility and user-friendliness of this site, both for the computer version and for the phone version. On that site, you'll find all the information you need. The cases are reported in real time. We have a geographical information system displaying the trajectory of cases as we announce them. You will find all the historical guidelines that we've released on social distancing, on self-isolation, on case definition. We try and update this as frequently as possible. So if you see any error, please let us know, but there's a team working specifically on this. All the IEC materials, information, education, and communication materials that we have shared with the states are also put up there. So if you have an organization, they want to start a campaign on any issue, pick out the material, convert it to your own use, as long as the content stays the same. You can put your logo, add whatever you want to add in terms of branding, just keep the content. For us, it's only important that the content stays specific so people know exactly what to do. We've had over 1 million views so far on this website, so people are using it. Many of just about 50–60% of viewers come from Nigeria, so there are lots of interest by Nigerians probably across the world wanting to know what we're doing in Nigeria to control this outbreak. So we also have a WhatsApp platform with information. So we're working very hard to make sure everybody is kept informed at all times. And we need you, ladies and gentlemen of the press, to help us disseminate this information. Information is power. Information needs to be gotten to the bottom of the community, and we really need you to work your magic, as you always do, to make sure Nigerians are informed, educated, and empowered. It is only by community engagement. Our people in the community are the strongest weapon we have. We need them to rise up, to take this as their own challenge, so we need you to reach them. Thank you very much for your time. I look forward to engaging with you further. Thank you.